Welcome back to Healthwise. With us once again is Dr. Paul Miller, one of our great nephrologists in Opelousas. Doc, you're now part of a board, I understand, and would you like to tell us a little bit about that board and what kind of actions y'all plan on taking?
The Louisiana Medicaid P&T Committee is the Pharmacy and Therapeutics Committee that is tasked with advising and recommending the state formulary for the Medicaid program and to help advise regarding the clinical benefits of the medications for the program and suggest improvements in it to help the populations, which, as you know, are some of the most at-risk population of health that we discussed earlier about. And it's an opportunity for me to help bring about the continuum at every angle. We talked about before, exercise,
right,
weight loss, and the other programs to help the most at-risk population. And so that committee is very important, and a lot of things that complex issues that go on there are selecting drugs in each class for patients. When you look at this, and I've studied a lot of this throughout the years, you look at the Veterans Administration, the VA medication formulary, what's on the list. So most veterans know that when they get their medications, there is a limit, and there's multiple reasons. It's the most well-studied formulary that is evidence-based, which means that it's time-proven and it's evidence-based. Now, there are some agents that do not have generics yet.
Right.
There are some single-class agents that are big elephants out there because they're usually very expensive.
Right.
And so the formulary for the Louisiana Medicaid is looked at from different aspects. It's looked at not just clinical benefit and class. It's looked at for its rebates or its opportunity for cost effectiveness. And it's difficult when you look at something and you look at formularies, right, and you compare them side to side and you say, here's the same class, let's say hypertension and kidney disease. You have ACE inhibitors and certain class agents. Well, we know ACE inhibitors are dirt cheap,
right,
okay? $3 or even less for a cash paying person to go, right, and buy them. Well, it's difficult to understand for some people when they look at a formulary and say, well, why are the pharmacists being paid almost $6 per prescription? Why don't we look at saving money here and being able to expand the opportunity for other services to other needy persons by saving money, by offering, to offer like we do in a preferred plan, to offer every 3 months prescription for chronic prescriptions and save on those fees, or to be able to bid out the formulary so that you can offer the opportunity to pharmacies, even in state, to say, I'll provide those services or mail-in services at a generic rate. And there's a lot to look at there because you're trying to make sure that your class agents are comparable, clinically proven, or the cheapest of class, trying to balance that, and offer the best bang for the buck that'll offer the patient the best opportunity to live healthy with the use of medications. It's very challenging because the current Medicaid program uses a consulting group, and a lot of the information is held from even us on the committee.
Wow.
The actual cost of the agents are actually held completely from us. And
that doesn't make sense.
I know that. And so when someone like me asks questions, and I ask a lot, say, hey, look, I want the best bang for the buck, but we have a veterans list, we have Kaiser Permanente's list, I've collected all these lists from around the country of large provider groups, Blue Cross Blue Shield, who manage large populations, commercial insurance,
right,
no insurance, all these different, even Veterans Administration, clients. And you look at the Medicaid list in the state of Louisiana and you say, oh my gosh, I can't even afford that medication.
So
is it really
right,
useful? And then it's explained that some medications are rebates. The federal government has like a TOPS, not TOPS for education, but a TOPS program that's a federal state type of match rebates where if you allow the pharmacy companies that make pharmaceutical companies to participate in your state formulary program, then they will offer rebates, but they don't show us the rebates. So we never get to see what the comparison side by side is with the same class agent, same comparable agents. And the problem is that, you know, I just have a problem not knowing what it is that we're actually paying for. And I think patients need to know. If a patient is on a Medicaid core, Medicaid benefit, there are a lot of patients out there that would want to know that if there's a comparable agent, that they are being efficient at it and not running the cost up in the system that's being good to them. Okay, I mean, let's face it, we never know where we are in life, but where we help people, we want to help them appropriately and efficiently to manage the program so it doesn't die out. I mean, look, right now we have a lot dying on the vine, and we want to manage it appropriately. So in these hidden costs and hidden expenses, it's difficult. I mean, when you see that when a company participates, it means that you have to accept all of their medications that they make on the formulary. So they may have 15 generic and 5 non-generic that are enormously expensive. You have to accept those. And the prior approval process, in my opinion, may need to be reviewed like prior approval for anyone who has commercial insurance. You just don't get the drug that comes out on the market today and think that you're not going to have to pay a larger copay for it. Right now in the state of Louisiana, if any drug comes out and FDA approved, immediately it's placed on the formulary for at least 6 months, immediately. And you know how many of those drugs are taken off the market in a 2-year period for unsafe reasons?
Right, that's what I was going to say. So you place it on there not knowing if it's going to be deemed unsafe.
It automatically gets on the formulary. And the prior approval process, so most patients can stay on that process. It's reviewed after 90 days or so. It's reviewed by the committee or some process I'm not really familiar with yet, I'm new to the committee. But it's a concern of mine because it's not the way that I'm used to doing. And I deal with this on a national level, a state level, looking at formularies, trying to be efficient while offering the best care I can safely. Thinking about the patients, thinking about the program.
Sure.
They're thinking about a patient. I don't even prescribe my children or parents medications that just come out. Because why? Because what if they're not safe?
Right.
So, and I'm not taking away from the drug companies. They do a lot of research. But here's my practice experience, my wisdom, a little bit I have, is I like seeing how things work out first.
Sure.
Those medications have been on the market for 20, 30 years. Old is not bad. And for all you people out there that are older, I like wisdom. I like seeing what people have made mistakes before me can teach me before I make mistakes on my patients. So the formulary program is something that is wonderful in its process. Understanding how medications or the true costs and rebates are hidden, I'm concerned about. And I'd like that to be looked at for a bid process where it's open. And we're not trying to give away everything to pharmaceutical companies and hiding rebates that are negotiated with the Secretary Sebelius of Health. We're trying to have an open process here so that we make sure the program integrity is intact. And if I'm going to vote on an issue, I want to know that I've given it well thought process and that my questions are answered. Utilization patterns, where are the gaps that we can improve? And I'd like to talk more about that, about some suggestions I have to improve it, and because the audience they have a lot of experience with medication taking.
Well, after this brief break for our sponsors, we'll come back and we'll talk some more about that with Dr. Paul Miller.